Hi, on this week's Health Talk, a very accomplished breast surgeon and a remarkable young woman will share a story which underscores the importance of breast self-examination. So don't go away, we're up next. I'm Dr. Eric Mazer. Today we're going to discuss breast health and breast cancer with Dr. Mandy Greenberg. She's a breast surgeon at Norwalk Hospital, been on before, and her patient, great story, Gigi Van Waes. I think I got it right. Gigi, welcome to the show, Mandy. Glad to have you back.
Thanks for having me again.
Now, Gigi, you're way too young to have breast cancer.
I would agree.
I think you're way too young to have any kind of cancer. How old are you, if you don't mind sharing that with our audience?
I'm 37 now, and I was 36 when
36.
I was diagnosed.
Women don't really think about breast cancer at 36, do you? Were you thinking about that?
No, I never would have expected it to happen to me.
So maybe you could give us a little idea of your story. You were, you're a young professional woman. You're working as in finance. Yep. I don't want to tell your story for you, but you've got 2 children.
Yeah.
And a wonderful husband. And so,
yeah.
So what happened?
Sure. So I would say I noticed really a difference in like the density of my breast. It was probably about 14 months ago. But initially I just thought, oh, this is something that reminds me of, maybe when I would have had, when the kids were babies or something. So I wasn't worried at all. And honestly, because I was smaller breasted, like I never in a million years thought I could get breast cancer even. So I waited a few weeks because I was really busy at work, but I set the date to go get it checked out, and went to my gynecologist's office, and they basically referred me to Mandy, who then, when I went to see her, I think she probably would say now she had initial concerns, but they said, oh, don't worry, you'll just go get it aspirated, you'll be fine, like implied that it would be a cyst.
So people thought it was a cyst,
yes.
even your gynecologist.
Yes, even made a comment that there's nothing concerning, and it'll probably just get aspirated.
And cysts are pretty common in young women, aren't they? Mandy, what did you think when you saw her?
Well, so initially, usually a 30-something-year-old with a new breast mass, it's either going to be a cyst, it's going to be a fibroadenoma, which is a totally benign solid mass in the breast, or maybe even some lumpy breast tissue that feels like a mass. But always in the back of my head, I know that at 36, it's unlikely she's going to have breast cancer, but it's always on the differential. So I did an exam, and she clearly had a difference in her breast, one side versus the other. There was clearly a hard mass there, which could have absolutely been a cyst. And I said, are you afraid of needles? I want to stick a needle in there, because if it's a cyst, I can aspirate fluid back, make it disappear, and we're done. And I put a needle in there, and I did not get fluid back. I got a bloody aspirate, and there was not a cyst there. And it seemed to be a solid mass. And it's a bad sign when you suck back fluid and it's not clear yellow fluid. You have to be concerned that it's something more going on.
When you examined her, before you did the aspiration, did you think that there was anything non-cystic about it? Were you suspicious?
It's a good question. So cysts, fibroadenomas, benign breast masses, they feel like balls in the breast, and generally you can move them around, even from one quadrant to a different quadrant of the breast. This was not moving. It didn't have clear, defined borders, so I was worried from the second that I laid hands on her, as awkward as that sounds. Yeah. But I knew from before she left the office that this was probably more than something benign going on. And immediately we got her set up for some imaging and a more formal biopsy.
Yeah. And I think that, maybe one of the several important messages there, but one is I don't think the exam is all that definitive, particularly from an inexperienced examiner, that it took someone like you, Mandy, who's examined this so many times to even suspect that it was cancerous. A good gynecologist suspected it was a cyst. Another message, I guess, is this happens to young people, so you can't get too cavalier about this. And probably the biggest credit to you is that you recognized that there was something different. And and Mandy, I think some of the screening agencies don't necessarily recommend breast self-exam. That's sort of academic in certain ways. Maybe you could explain how that could be, and yet here we have somebody that may have been saved by breast self-exam.
So the American Cancer Society changed their recommendations recently, and they said that women should not be doing monthly self-exams, physicians should not be doing yearly clinical exams, and average women shouldn't be getting their mammograms really formally until age 45. It's questionable between ages 40 and 44, yet I sit next to a woman who had a stage 2 cancer that was found on self-exam at age 36. And so my message is really know your breast. You don't have to do your breast exam every single month on the exact same date, but know what you're looking at, know what you're feeling, and pay attention. You know, there's no downside to doing a breast exam. The arguments are you're not diagnosing a lot of cancers and there's a lot of false positives, but I can't tell you how many women I meet would rather have those false positives, meaning go through biopsies, go through imaging, find out that there isn't really a problem, and then, you know, get diagnosed, because you can't afford to miss it. And it doesn't take a lot to do a breast exam when you're seeing the gynecologist, when you're seeing the primary care.
Right, and I mean, I guess what I'd add to that is, I mean, I had been in for my annual examination in February, and mine was so fast growing that had I waited, I mean, it could be stage 4. So had I not gone in after noticing myself.
But you said you used an interesting term. You said there was a different texture.
Right.
You didn't really feel a mass. You didn't really feel even the cyst. It sounds like it just.
Yeah.
But that's important. And let me ask you, Mandy, I'm not being a woman, but I know that in menstruating women, their breast cycles with their menses, and there can be changes. So how does a woman differentiate changes that are just part of her menstrual cycle from changes where she should go and seek help?
Well, you can wait out a menstrual cycle and see what happens, which is part of what Gigi did, is wait for your period to come and see if your breast changes. If it doesn't change, then maybe it's something worth getting examined. And gynecologists, you know, they do a great job. It's not their job to figure out the diagnosis. It's their job to assess and realize, okay, there's something going on. It may be a cyst, it may not be, but let me send you to somebody who can take the next steps. And so,
and what I think one of the emphasis is, I would be reluctant to take somebody's word. If I'm concerned about my own breast or my wife's breast, and I go see a primary care physician or even a gynecologist who then says, oh no, this is perfectly okay, I'd be a little reluctant if I'm really sure there's a change there. Maybe you want to say some words about that.
Yeah, I mean, that's the first rule of surgery, which is trust no one. You have to do the exam yourself. You have to look at the imaging yourself. You have to review the reports yourself. You know, it's not that I don't trust my patients and the physicians. They just don't always know what they're doing. I do breast exams every day, all day. A primary care doctor may do one every couple of months, and, you know, in different ages and different sized breasts.
I've certainly seen in my career, when I used to do oncology, I'm sure you've seen this, people who had suspicious masses or masses
that are totally benign and there's nothing there,
or I was
and
going to
vice
say
versa.
that are malignant, but where people have discounted them until, for one reason or another, they finally sought a second opinion. And the other thing that people I just want to warn them about, and I've seen this as well, someone comes in and say that they found a mass, the practitioner may send them for a mammogram. Mammogram's negative. They say, oh, the mammogram's negative, you don't have anything to worry about. The mammogram does not rule out cancer.
And I see that all the time. I get referred a patient by a gynecologist, they go for their imaging is negative, they cancel their exam. There are some types of cancers, especially invasive lobular cancers or even inflammatory cancers, where the imaging is negative, but it doesn't mean that you don't have cancer. There's always more. If there truly is a mass there, it may not show up on mammogram, especially in women who have dense breasts.
Or in the axillary tail, which is the breast, they may miss it on the, on the mammogram.
So there's always more. We could always do a breast MRI if you're truly suspicious that there's something going on.
Okay, so again, it's not something to play with, not to over-alarm people, but if you feel a definite change in your breasts, it doesn't go away with your menstrual cycle, it's worth getting that looked at.
Yes. Right.
Now again,
I
guess the biggest problem, again, as a primary care or even doing oncology, especially in younger women who have fibrous breast tissue, dense breasts, a lot of sort of fibronodularity, how do you differentiate those?
Imaging.
Exam.
I mean, imaging helps. Sometimes on exam, I can't tell whether something is really a mass or not, and that's where I rely on my imaging to help get more information. And if I'm suspicious, as I said before, and the mammogram and ultrasound aren't telling, then there's always the option of an MRI.
MRI, which is very sensitive, but sometimes a lot of false positives,
which is the downside of MRI. But if you're really worried, you know, everyone's willing to go through those false positive findings to rule out something more serious.
So going back to Gigi's story, you had kind of a young woman thinking about cancer, you had a young family. What happened when you found out you had cancer? Did you tell her?
I did.
It's not a
I told her
pleasant thing for
everything
anyone.
every step of the way.
Yeah, we remember exactly where we were sitting when we talked to Mandy.
I mean, your world must have rocked.
Yes, completely. I mean,
And I'm saying in a
completely. My
negative
husband
way,
and I
but-
probably, cried for the first couple weeks until we could wrap our heads around, until all the results came back. I think that was, getting all the results that first 2 weeks was the most difficult. Because, someone tells you they think it's cancer. Well, then you go in for the biopsy. Then you always have to wait, 3 days to find out the biopsy results. Then you find out you have cancer, then you're waiting, is it in the lymph nodes too? Then you find out it's in the lymph nodes too. Then you're waiting for the
next shoe to
chromosome,
drop.
the positives and the negatives to come back. So, we did my husband did a lot of reading and us trying to, rationalize what was going on and still remain positive before
How do
we
you do
had.
that again with
I
young children? Well, you're
yeah,
sort of a positive person,
yeah.
but I know for me, if I were in that
Well-
situation, all I would do would be morose about not being there
And
for my
I
children.
mean, I think, in my mind, I was thinking I'm going to die, and that was just traumatic to me. In my husband's mind, he's thinking I'm going to lose my wife, and I'm going to have the kids by myself. So, I mean, I think what allowed us to be positive was, I think, kind of thinking about our prayers almost along the way. It was initially like, okay, don't let me have cancer. Then it was, okay, don't let it be in my lymph nodes too. Then you get the answers back to that, and it's bad news every day. So you keep praying for something like a little less. And the last was like, don't let it be, don't let it be triple negative. Don't let it be stage 4. And that was, I think in my mind,
A lot of people don't know what triple negative is. Maybe.
Right. Oh, I'm sorry. So I don't even really know everything, but the 3 chromosomes or 3
Hormone
hormone
receptors.
receptors hormone receptors that get tested. I guess the most the strongest chemotherapy is for the triple negative,
yeah,
and I ended up being triple positive.
Which is pretty unusual, isn't it? Isn't it unusual to be estrogen and progesterone receptor positive and HER2 new?
It happens. It happens.
Okay. So I think that was good news, and then,
So we
I
finally
think
got some good
in
news.
That was like the first.
And then all the
piece of
good news started coming.
And then, it was. I'll never forget the week, and then it was even stage 2 or stage 3 because it was always we weren't sure. As long as it wasn't 4 to me,
Yeah.
I was like, I can deal with this, and I could be much more positive.
With good reason, with rational.
Yeah, in that I can fight this, because that's what we were reading. Like, kind of, my husband was,
And again, for people at home, stage 2 and 3 is the cancer is really confined to the breast and the lymph nodes.
And
that
the
area.
size of the
Right.
cancer. The difference
And the
between stage 2 and stage 3 is a cancer 5 centimeters or below or above 5 centimeters, and how many lymph nodes are involved.
So
it
where
has to do
stage
with
4 usually means it's spread
it's
outside
spread
of
beyond
that
the
region.
lymph nodes.
right,
So and that can be
and
very
not curable, right? I mean, like
in the
if-
conventional.
yeah.
Although once in a while we've all seen
Right,
patients.
and I've
Yeah,
read good
we
stories
have
there
'em.
too.
What's that?
So,
We have them.
We
And
certainly-
then in Gigi's case, there was also a question of whether or not the skin was actually involved with cancer cells. And we didn't really pursue that too much. We had a lot of people examine her and voice their opinions, but it would lead to more biopsies to get that answer, which wasn't going to change any treatment or
Right.
outcome.
So
So we
it-
decided to leave it alone.
So that's all we have time for this segment. But when we come back, then we can talk a little bit about what you had done to you, how
Oh,
you
yeah.
maintained your
Great.
spirit through all that, how we all get energized by somebody like you with your spirit, and then maybe some hopeful words for folks at home. So we'll be back after this short break, but stay tuned. Hi, I'm back with Dr. Mandy Greenberg and her patient Gigi Van Waes, hearing really a remarkable story for somebody, actually for anybody, but someone so young. So you had this big breast mass. It was, I guess lymph nodes were involved. And how did you decide on treatment planning for that, Mandy?
Well, so
We
surgically,
hear a lot about lumpectomies and breast
Right.
conservation
Right.
and all of that. I'm
So-
sure that goes through your mind, particularly as a young woman.
there's 2 options for surgery with breast cancer. There's a lumpectomy where you take the lump out and tissue around it to make sure you get it all, and then you deal with the lymph nodes separately. And then there's a mastectomy where you remove the entire breast and reconstruct it. And in Gigi's case, her breast cancer was so large based on the size of her breast that there wasn't a lot of option in terms of surgery. Once we got the hormone receptors back and found out that she had HER2 positive cancer. HER2 positive cancers are more aggressive, but also very responsive to chemotherapy. We knew it had already escaped her breast and gone to the lymph nodes, so I sent her to Dr. Rich Zelkowitz for a consultation to talk about neoadjuvant chemotherapy, the option of giving her chemotherapy before surgery. We already knew she was going to need surgery and chemo, so the order of events didn't really matter, but if we could shrink the cancer up front and start her on some treatment right away, we may be able to improve her surgical outcome.
And maybe we say a few words, again, for folks at home who often don't understand adjuvant and neoadjuvant therapy. In your case, it was to shrink the tumor, make the surgery easier and maybe less deforming, but also we presume when there's as much cancer as there was locally that there may be microscopic deposits of cancer elsewhere in the body. And the idea of adjuvant therapy is it cleans up all those deposits that you can't see on X-ray, you can't detect on bone scans, and render somebody cured. So we know that sort of statistically. So you then faced neoadjuvant. Well, you're raising 2 children now.
Yeah.
So how did you possibly manage? Were your parents around to help out?
My kids were amazing. My husband's parents are local, and they were amazing. We couldn't have done it without their help. And then my mother and my sister traveled from Pennsylvania several times, like a lot, more than I've ever seen them, since I've been away. So everyone was just amazing. I think it was really great. The hospital offers up the services of a therapist, a family counselor basically that we spoke to understand what do we say to our children, because everything I would have thought we should shy away from is exactly what we should be saying.
Tell us more about that.
So where I would think you should never tell your child you have cancer because they're going to think you're going to die, I would have tried to keep it a secret. Basically, the family therapist says, no, actually, you have to tell them exactly what's going on. You have to make sure your kids, because they're 4 and 6, at the time they were 3 and 5, you have to make sure they're getting all of their information from you, that they know it has nothing to do with them, that they aren't to blame, that there isn't any whispering around them, and that they know everything that's going on. And I mean, from the moment we told them, it was the biggest relief. They acted like 2 little adults, and the family therapist explained to them there's something inside your breast that shouldn't be there, and that you're going to have really strong medicine that's going to make it go away. But that strong medicine is also going to make all your hair fall out. So it kind of took care of everything at once.
Did you discuss the potential mortality with them? Or
we did not.
So it was really just that you're going to be going through this process and it's going to make you better.
Exactly. Like, mommy's going to have really strong medicine. She's going to need to rest a lot. She's not going to be able to play with you as much. And I mean, it helps so much. I think your question, that was the one thing that in my mind concerned me, because no one ever told me I'm going to be okay. And even the family therapist said, let them know you're going to be okay, if that's what they told you. And I'm just like, well, no one actually told me I'm going to be okay. And finally, I think at some point, maybe after all of the chemo, I just looked at Dr. Zelkowitz and I said, is anyone ever going to tell me I'm going to be okay? And he said, oh, you're going to be, I think at that point in time, you're going to be okay.
I kind of took it for granted and assumed that you knew that you were going to be fine.
So I think that was after, I'm trying to remember exactly when that was, but telling them was so helpful. They were amazing. They were just so supportive. My husband was amazing. So luckily we've had so much help from family and friends that just helped us get through it.
And how did you decide? You had all the chemotherapy and and I guess Herceptin was part of this as well.
Yes.
And then Mandy, what were you faced with then when you did the surgery?
Well,
this stuff doesn't disappear. You can't make it disappear with a little touch of radiation. You need surgery.
Well, we knew, based on, we did imaging before all this happened, and we did imaging when it was done, and we had a really good response on imaging. It looked like things had shrunk. You couldn't really tell exactly what was left, and when you give neoadjuvant chemotherapy, cancer either shrinks like an ice cube where it gets smaller and smaller and smaller, or it shrinks like Swiss cheese where you're poking holes in it. So you may still have the same, extent of the cancer, just less mass of it. And so we had talked up front that there was no deviating in what our surgical plan was. So we had planned for mastectomies, we had planned to evaluate the lymph nodes, and that wasn't changing. And so we moved forward with that. We did the mastectomies. I had a plastic surgeon there with us who Gigi had met before, and everything was all set. And we removed the lymph nodes. And when the pathology finally came back a couple days later, it was fantastic news. The only thing left out of everything was a tiny little spot of precancerous cells in her breast. Everything else had melted away.
So of course that's great news. That begins
It
to
was
tell
great
you.
news because I can tell you my perspective on the imaging was not positive. Like, because I remember when we had the imaging done before surgery, it had still shown a mass, but Mandy had said, you know, it's probably scar tissue. Well, in my mind, I'm like, I think it had still been 2 centimeters. I forget. Like,
Yeah, your exam hadn't gone completely normal,
Yeah.
so you could still feel some degree of fibrosis,
Which
but
is
that could just
yeah,
be the
which
response
is
to the
good.
chemotherapy.
Which is, I think, really hard when you're a cancer doctor, because you often, or for patients, because you can treat something effectively and you're left with scar tissue, and some of the imaging modality can't tell the difference.
Right. So I remember I was still incredibly worried after the imaging came back that, oh my goodness, how could it have only shrunk? But then basically it completely was gone once we finally got
Again, the good news, it also tells you that your tumor type was very responsive to the
Right.
therapy, which means any microscopic deposits were probably knocked out as well.
hopefully.
Yes, because
So
the
did
lymph
you
nodes
do
were all negative.
reconstruction then right at the time of surgery?
Yeah, so Gigi can tell you more. She had implants placed.
Or the tissue expanders.
The tissue expanders.
That I still have. So, so I've had the tissue expanders since April. I actually, there was a slight complication during the first surgery, and one of them didn't seem to be right. So I had to get another surgery a couple weeks later, but it was easy. And I finally in January will get the final exchange surgery, which will give me the final implants.
Yes, just, again, and don't answer if you don't feel it, but as a young woman, where body image, I guess, to all of us as young people is very important. What did this do to you?
Yeah,
And how have you reconciled this terrible experience?
Yeah. I mean, body image is very important to me. I think I feel much more comfortable with my clothes on than I do with my clothes off at this point. But I remember back to the beginning when my husband and I first were faced with this news, it was like I would cut my arm off to not have this, So you would do anything to not have it. So to then say, I can't deal with having, no nipples, for example, just seems contradictory to the way you felt initially. So we've tried to always compare to how did we initially feel and where are we versus that. And I think, I don't love the way I look, but I hope it continues to improve, and I trust the plastic surgeon. And
it will get so much better once the implants are put in.
Because I've seen several women who have had very successful reconstructive surgery, and it's fabulous. I mean, you want to say things.
Well, the expanders are not meant to be permanent objects in the breast, and so they don't have the same size and shape and texture as the implants. It's a placeholder, and so the implants are much softer. They look a lot more natural, and when the plastic surgeon puts them in, they go in with a fat transfer. So they do some liposuction and inject some fat in some areas that may need a little bit more volume. So it's a dramatic difference once the
And they reconstruct the
done.
nipple, don't they?
Either
Or
reconstruct it or tattoo it or really do nothing. It's patient preference. Once you get to that point, it's up to you what you want to do, if anything.
But so the hope would be that you would come back not exactly like you were before, but resembling how you were before.
Yeah. So, I mean, it's been a great, the process has been fine. I'm excited to finally have the final exchange surgery will be in January, which I guess is, basically 9 months
And they told
afterwards.
me, you heard that term, exchange therapy, being exchanging the expander for the permanent implant. Is that what we're talking? And the expander is like a water-filled balloon under the skin.
It's like a hard rock.
Well, once it's fully at its potential, it's like a hard rock. But it's basically like a sturdier implant that you take all the fluid out of it, you put it in, and then over time you slowly expand it with fluid because you're making space for the implant. You can't put the implant, you're stretching the skin over time, because if you stretch the skin immediately, the skin is already unhappy from having the mastectomy that same day, and so you want to give skin time to recover before you put it back to work.
Excuse me, did you have radiation as
and
well?
that's what I was just going to add, is the radiation even makes it, I think, more complicated.
And that's my understanding.
So I had radiation for 20 weeks.
Do you have whole breast and axillary
20 weeks.
radiation?
No,
20
not 20,
sessions?
20 sessions.
Yeah, that's 20 weeks of
20,
radiation.
20 sessions, I guess that would be, it was like 6 weeks, 7 weeks? Yeah.
That sounds about right.
Sorry, thanks for correcting me. And that makes it even, like, the skin even tighter.
Right.
So I can tell a huge difference between my left and my right. So the cancer had been on my right side, and this tightness of the skin on my right is just so much different. Like, it's so much tighter and more uncomfortable. But what was interesting from the start with what Mandy had told me was that I really won't feel anything with the mastectomy because of all the tissue being removed or the nerves being removed. I really don't feel much. So that's kind of strange too. And also with the lymph nodes being removed, parts of my arm I don't have any feeling there. But it's coming back a little bit.
Okay, take what we can get.
But that was
But you
interesting
have
to
to
me.
cut certain nerves as you
Yeah,
move
her lymph node story was complicated. She had the lymph node biopsy before we did any chemotherapy, and they left a little biopsy clip in the lymph node that was biopsied that was positive. And then she had chemotherapy, which basically scars and shrinks down the lymph nodes and groups them together. And then for surgery, because she had a dramatic response, we can do another sentinel lymph node biopsy and get out the initial lymph node that was biopsied. Well, the dyes for the sentinel lymph node biopsy didn't travel anywhere. There was no blue dye, there was no radioactive dye, which is what we use to delineate the lymph nodes. And so I know Gigi, and she's basically me as, in that chair. And so I removed the majority of the lymph nodes because that's the only way to guarantee that I had the whole story.
We have like 15 seconds left. So how do you feel going into your future?
Great. Feel really good. Very positive.
How has this changed your life?
More attentive to myself, like outside of work. So making sure I make time for doctor's appointments and just really, embracing the family and
ultimately it seems to reemphasize the values that we know up here are important, but we forget in our day-to-day activities.
Yeah.
They sort of get lost. Not that they did for you,
No,
but I know
they
that
do. Yeah, they do.
Well, I'm so happy to see you doing so well.
Thank you.
You're just you're
She's
sparkling.
amazing.
Thank you.
That's a perfect
you.
word for her, sparkling. She's incredible.
Thank you.
Yeah, thank you for doing and curing such a wonderful woman. That's great. So thank you. When we come back, we'll have today's health question. Right now, let's take a look at some of the upcoming events sponsored by Western Connecticut Health Network. Hi, this week's question is, can physical activity reduce the risk of breast cancer? Well, physical activity seems to reduce the risk of everything, but
yes.
Mandy, does it help in reducing your risk of breast cancer?
It does. It helps in a couple ways. It helps reduce the amount of fat in your body, which we know produces estrogen, which is a risk factor for breast cancer. It also helps reduce stress, which we also know can increase cancer recurrence and help other cancers develop.
How about the repetitive trauma if you're a runner or something? Does that have anything to do? I think some women correlate trauma with breast cancer.
There's no relationship between trauma and breast cancer. I mean, I think that you hear stories about women who bump themselves and then feel a mass and the mass is cancer. I think it's an absolute coincidence that the trauma
That's been my
noted
thinking
something.
too. If somebody bumps their breast, they start to feel it and suddenly they feel a lump.
Trauma does not cause cancer, at least not in the breast.
And in terms of breast self-exam, despite the recommendations, what are yours?
Do it.
Do it. Absolutely do it.
Yeah, do it. It certainly, it may have saved
What's it gonna
your
hurt?
life.
I think it did save my life, yeah.
As long as it doesn't create so much anxiety for the people. But again, know your breasts. You're going to know them better than any doctor, and you'll be able to tell whether there's something really different there. So really a pleasure meeting you. Want to wish you success for the rest of your life.
Thank you.
And your children, and just enjoy yourself. And hopefully this is almost over.
Thank you.
For you.
Thank
Thank you, Mandy, for coming on the show.
You're welcome. Thanks for having me.
If you have a question you'd like to ask on Health Talk, please contact me at healthtalk@norwalkhealth.org. I want to thank our guests today, Dr. Mandy Greenberg and Gigi Van Waes, for coming on the show, sharing those very personal stories. I'll see you next week on Health Talk.